Sorry, my hands are probably cold. So warm whatever you're using up in your hands first, because your hands are always going to be colder than their back. Sorry. So I was a massage therapist for 7 years before I went to nursing school. It's been a while since I've done this. But my lovely friend Sarah here has agreed to help us out. Wave to the camera, Sarah. See? Sarah. So you want to start by moving down the body towards the sacrum on either side of the spine, using most of the pressure in the heel of your hands and then alternating back and forth between your fingers, but keeping the tips of your fingers kind of elevated in like a boat, so that you don't cause too much pressure in one spot while you're still warming the muscle up. And as the muscle warms up, then you can use more precise pressure. Using precise pressure at the beginning is very painful, so don't do that. And these strokes are considered effleurage, or the mainstay of Swedish massage. And so when you reach the bottom of the back, and you get to the sacrum, you kind of heel your hands out like this. So you're going down the spine and heeling your hands out on either side, so that you're spreading that pressure, because you're going to naturally lean into it. And you do the same thing with your thumbs. When you use your thumbs, you go out towards the hips, making sure to not put pressure on those bones. You're going on, remember, you're focusing on the muscle and the fatty parts. And so I know you can't really see her anatomy here, but spine is about here, and this is where her shoulder blade is. So you want to make sure that you're keeping your pressure off of the bones and staying on the bulk of the muscle. And where her muscle is largest is where you're using the more precise pressure. We call that the belly of the muscle. Oh, and something I also do is I alternate. So this is a spinal stretch, and I'm just leaving this hand here to make sure that I don't overstretch. And the same to the other side. And you always want to follow the natural curvature of the spine. And fun fact, as a massage therapist, you can almost always tell what dominant side someone has based on their musculature. So unless they're like a power lifter or a workout nut, you can almost always tell, because that muscle, like Sarah here, is left-handed. So this part of her traps and the rhomboids here is much more developed, and you can tell too because of the way the tension develops. So usually people who are, not ambidextrous, if you're right-handed or you're left-handed, the side that you're dominant on will do more fine motor things and is also usually stronger. So when you're doing more fine motor things with your arms, the rhomboids and the traps are required to be more in control in order to complete those tasks. So they develop differently. Got a lot of hair, girl. So normally at this point I would ask how the pressure is it too much, things of that nature. I've worked on Sarah enough times to know what she likes, so. Something people underestimate a lot of the time is how much time it really does take to get a muscle warm before you actually start working it. So I'm not using any real pressure yet. This is just slightly deeper effleurage strokes. I'm still warming up the first few layers of that muscle. And you can kind of feel as you're going how those layers come away, and they start to feel softer and softer. That doesn't mean that you're clear to work deeply yet. It just means that you're getting there. And a lot of people think that deep tissue work requires more strength and more pressure and it should hurt and whatever, but that's not true. Deep tissue work is all about sifting through the layers of tissue and sifting through those layers of muscle and getting that fascia to release so that you can get down to those deeper tissues. It's not all about pressure. And so you'll see most of my strokes are going down the length of the spine, following the curve of the shoulder blade here. Never putting too much pressure on the ribs and the floating ribs especially, and staying away from where those organs are in that retroperitoneal cavity. We don't want to punch a kidney. And the strokes that do come back up like this are always of precise pressure. You go right along the spine and then finish out those traps at the edge of the shoulders. And that's just to make sure that you're getting the whole muscle warm. And if you're going to use a more diffuse pressure, I use the heels of my hands to follow that spine so that it's still pretty precisely located. Because if you use too diffuse of a pressure in that area, it just kind of sucks, it hurts. And people feel like you're pushing them off the table. So her muscles are now workably warm. And so you'll see more and more thumb from me. And this is the edge of her bone here. And this is her spine here. And so you work right in between and you can feel kind of this, it's almost like a shelf at the top here where your trapezius muscle comes up like this in that big trapezoid shape, but your rhomboids are just so centrally located right here. And people think it's the traps that are the worst, but honestly it's the rhomboids that cause the most shoulder pain and the most back pain. And so Sarah has a lot of active trigger points is what we call it. I guess you can't really see, but you can find those by going over them with your thumb, and they'll kind of snap as you go over them. And it'll be a very small area that just kind of escapes from your thumb. And then you're able to kind of find this central spot to it. so those require, active trigger points require like a special type of pressure, and you have to find the way that they want to go, like the direction and the angle that they're sitting at. So if you're looking at it in a 3D image, right, this is the muscle, and trigger points are usually at an angle like this. And so, or, you know, inversely like that. And so you want to come at them from the angle that they want you to, and you apply this precise pressure, and you try to time it with their breathing so that they naturally relax. And you can feel them fall away as you do. And people like this who do a lot of computer work or desk work or over the head lifting or things of that nature, they'll have a few that are kind of right close to each other. And so you'll feel one go, and then you'll think you missed it. But then as you use the wider part of your thumb to go back over it, you'll feel that it's gone, but there's one ahead of it. And this is a shiatsu technique, which is an acupressure. So not acupuncture. Acupuncture is using needles, but we're using acupressure. And remember that when you switch sides or regions from upper back to lower back or whatever, you have to rewarm that muscle. It's already pre-warmed up for you, but you got to make sure that that blood is still moving through there so that you don't cause any damage. Just like how you have to warm up before you exercise. And so the issues that she has on her left side are markedly larger. With larger muscles, then generally take slightly more pressure. But as you can see, it's not like I'm leaning into these. I can do it all just with the strength of my hand. You're always going to want to move whatever you release through the muscles to help take those toxins back to that lymphatic system and get them expelled from the system.